for inviting. It's actually an honor to be here, um, and it was very kind of you to escort me. I got lost, and actually it was my fault. I drove by it. I was distracted by Macaroni's Grill. It was used to eat there a lot, and you know, I'm from Towson actually, and I was embarrassed to ask for directions, but I said I'm going to call Kathy anyway. And she's very patient, did a great job. It's a very nice company, and I know you guys, you know, staying here, you know, spending time here, it means a lot to us here that you're here. We'll spend probably 20-25 minutes with the presentation, and then after that we'll give time for you to ask questions. But if there's any point during the presentation you want to ask questions, just raise your hand and feel free to, you know, to interrupt, because this presentation is for you, and we want it to be as interactive as possible. And we want to make sure that we are answering your concerns, because this topic is very relevant and very important, and it's part of the wellness activity. We want you all to be well. This company, as I understand, has been here for more than 40-50 years. And this fine gentleman has been here for 40 years. Let's give him a big hand. Yeah.
He's been here longer than I have.
Longer. Okay. So whatever your staying power is, I commend you, sir. We have the objective here to look at depression, and we're going to start off, and that's the objective, to sort of explore depression and the symptoms from a physical and an emotional perspective, to recognize it more, since it is pretty much underdiagnosed, and to sort of explore ways how you could get treatment and make sure that we are understanding how it could be better and better understood. We may need a volunteer, and we may, I was speaking on one. Oh, there you go. Oh, thank you.
I think that'll.
Oh, thank you very
There
much.
might be one. Maybe not.
If not, we can just, I think, do it this way. Right?
Yeah. Or if you want to use.
Oh, this one. Thank you. This one, we just do this one. There you go. Who's Chucky? Green shirt. Green shirt. Chucky, you want to volunteer?
I guess I can.
You've been nominated. So I heard Chucky, you'd like to volunteer all the time.
I'd rather pass, but I'll
Yeah, yes,
help
yes.
you. What do you need?
Oh, would you be so kind to come on down for a minute? Let's give him a big hand. Yeah. Thank you.
Is that back corner? Oh.
Yes, yes.
Anything back there?
So, how about you stand over here, Chucky? And we've got a great audience here. And could you? Here's a gentleman, and he's looking straight, and he comes in to present to an office. And if you could read to us. I have a. You need a copy? Would you like a- Oh, here. We have a couple more here. Right here. Thank you. And with your nice Chucky voice, would you read it to our audience? Go ahead.
Okay, the history of a 90-year-old man who lives in a nursing home
Oh.
is seen for a scheduled period like this. He denies present symptoms except for long-standing discomfort, a range of moderate to left shoulder. Physical examination, inventory, age man, blood pressure 154/86, pulse 64, while seated, pulse 144/82, 166 while standing, markedly reduced global range of motion in the left shoulder, nearly normal range of moderation in the right, talks a little bit clearer, comprehends examiner's speech, which is asked about his experience in Europe in the World War II, says, "Ask my son."
Thank you very much.
Okay.
Good. Let's give him a big hand again. Thank you. Thank you. So a gentleman comes in, and I'm just going to emphasize the examiner asks him, can you ask me about your experience in World War II? And he replies in this with his facial expression, "Ask my son." Right? And don't worry about these vital signs here. Sometimes when you take tests, there are tests that, I'll give you a clue, they sometimes try to distract you. I was never a good test taker. But he comes in and he's having these symptoms. He's having reduced range of motion, just like Chucky was mentioning, in his left shoulder. So he's having a little bit of pain. Right, so that's initially his symptom. And just doesn't want to talk about, and of course you'd think he'd want to talk about, he's a vet, he'd like to talk about those experiences. So we're going to ask the audience here, ask you guys,
Or click the other button
oh, okay. Oh, sorry.
on the others.
I'm sorry. Okay.
This.
Oh, okay. That's all. Thank you.
Yeah.
I guess so. Does it work? There you go. Thank you.
Yep.
So, what is your impression? And you can take a vote if you want. A, normal depression. B, is it major depression? C, is it persistent depression? D, is it bipolar disorder? E, is it dementia? All right. A, and then nobody gets penalized, right? A, how many think it's normal depression? Raise your hand. Okay. How many think it's B, major depression? Okay. C, how many think it's persistent depression? Okay. D, how many think it's bipolar disorder? Okay. How many think it's dementia? Okay. This one, right?
Yep.
I can't even remember. I have dementia. So we'll save the answer for. Do you want the answer now or later? How many want the answer now? Okay. Everybody wants the answer now. So, when we answered the question where we had folks, a majority, the deal breaker was ask my son. So a lot of folks would come in, and they'd come in to a doctor's office. And initially, folks would come in to the primary care doctor when folks were having issues with depression. They would initially present with physical symptoms, and they would initially come to the primary care doc because they were the ones that were more accessible, and they were the ones that were more available. And physical symptoms, if often than not, present, and depression initially presents as physical symptoms. He was found out, and he was found to have, when we further diagnosed him, and as we will talk about later, he was found to have significant symptoms of major depression. On a superficial basis, we thought, yeah, maybe the guy could have had memory problems. Maybe the guy was just not interested about talking. But one of the more significant symptoms of major depression is when you've lost interest, in things you used to enjoy, such as music, such as talking with your family. And in this case, this gentleman was clearly a proud vet, had served our country very well, and in his past few years, leading up to 6 months, he was very proud to talk about his service. Then he lost interest talking about it. He just didn't want to talk anymore. His family would come down, they want to get out of his room. So one of the classic concerns about depression is when you've lost interest in things you used to enjoy. And that persists. That persists. It doesn't just last for a day. It lasts more than just a week, 2 weeks, and it persists.
Good question.
Yes, please.
Ask my son, isn't that a sign of dementia? They can't remember?
Right, so,
I'll take that. It's a portion of that. Would you think that?
right, and that's a very good
I
question.
mean, you can go that way too, a little bit. He can't remember, or he's forgot.
Right.
He's 90. I mean, he's not 22.
Right, and I'm glad you brought that up because we oftentimes can think of it as dementia.
That's what it's shies that way to me.
Correct.
He would have said that.
Right, and I agree with you. That's why it deserves further investigation. If it were, so dementia and depression, what is one of the differences? Dementia is more gradual over a period of time. So here we found out this was something that occurred over a period of 1 to 2 weeks. Dementia takes months. Dementia not only occurs just in memory, and we often think dementia is memory, but actually it's your inability to take care of yourself. So this, in dementia, the first thing that goes is not necessarily your memory. It's your ability to take care of yourself in terms of bathing, feeding, dressing. Family members will say, oh, Mom, or Dad, we can't take care of you anymore. You're urinating again in the sofa. You're wandering out on the street again. Those are the symptoms, classic of actually dementia, not necessarily memory. You bring up a very important period, a very classic symptom, when this, yes, it could be dementia, and that's why a lot of people thought, oh, maybe it's dementia. I hate to tell you, I got lost here. Maybe I have dementia. We use it very loosely. And
It doesn't say that it's occurred in 2 weeks on that paper. I don't read that.
That's correct. And we don't give that information to you, which we should. And that's why it deserves further investigation.
Okay.
Where we should do more other tests like blood tests, vitamin B12, folate, an MRI, CAT scan. And we tend to, and again, we didn't give it to you, it's a trick question also, but we tend to jump to conclusions. So dementia isn't necessarily just memory. It's those other symptoms where, like I mentioned, that are affecting your ability to function. The classic period there is when we end up and we make that difficult decision, do we or do we not put them in a facility? It's because we can't take care of them anymore. It's a safety concern. We leave the stove on, or do we have that concern where they are not able to pay their checks anymore? Many other symptoms. So I'm glad you brought that up.
Maybe bringing up the World War II was a sore subject and you didn't feel like talking about
So,
it.
and there could be other symptoms like trauma.
The memories from the
That's
war.
true.
that
That's
you
true.
would've-
That is correct. So we talked about these symptoms. There are, and you mentioned emotional symptoms, sadness, the loss of interest or pleasure, a term we called anhedonia. Anhedonia, you may have come up with that term, but that translated in simple terms is loss of pleasure, overwhelmed, anxiety, you're diminished ability to think or concentrate, which overlaps with dementia. But remember, dementia is a different concern where it's a different age group and there are more than other symptoms we're concerned. And remember, the trigger, the deal breaker is when there's fecal or urinary incontinence, when we are unable to take care of them at home anymore. Those are the symptoms that you don't see in the dementia. And feeling so guilty. This is the ones that we talk about that we're concerned, the physical symptoms, the aches, headaches, sleep disturbances, fatigue, back pain, and the weight loss. I wanted to mention also, you may find that you can't eat, sleep, or eat, and you have headaches and pains that seem to have sprung up without a cause. And I wanted to highlight in this slide that the depression that we have has physical as well as emotional symptoms.
Well, why does it
Yes.
manifest itself physically?
So that's a good question as well. It has it's a defect of both chemistry and it's a defect with in this one here. Physical symptoms are often the chief complaint in depressed symptoms. In a Journal of Medicine study, 69 of diagnosed depressed patients reported unexplained physical symptoms as their chief complaint. The concern is, for example, and you've probably heard of neurotransmitters like serotonin, norepinephrine, and dopamine. They overlap. They overlap with a lot of the other chemistry that we have. So, for example, if I were, we talk about medications later, they have, when they function in the brain, they have a lot of the, when it comes to the pathways in the brain, they overlap in their ability to help us. So it's not just when you say in the brain, it's actually in the brain. So when they come out as depression, we thought before it's all just emotional, when actually it is a physical concern. We just don't understand it that way because of many factors. One of them is stigma. So we would just say, maybe you can just will it away. Maybe you can just snap out of it. It's hard when when fatigue, for example, is a big factor for depression. So it's part of the whole chemistry of the depression. That's why medications, when we started to understand them better, we have to treat the pathways of where they come from, and it's both physical and emotional. So serotonin, dopamine, and norepinephrine are those pathways that involve the physical symptoms. Many years ago, we didn't treat depression with medication. That's why they didn't work that way. And that's why there's unexplained physical symptoms. They come in here and they present, for example, they'll come in and say, I have a sore ankle. Before we think it's an injury and before we treat it, and you may have had cases, or you may have had friends who they've had an MRI, a CAT scan, everything's normal. Why is it they're still having persistent complaints? It could be something else. It could be a depression. Maybe we just haven't considered that yet.